There seems to still be a lot of misconceptions about mental health. Many people come in and they think depression is purely genetic. Certainly there is a genetic component to depression that may make some of us more susceptible to depression than others of us, but a lot of what sets us up for depression is more than our genes. It's also what happens to us. All of us experience trauma at different stages of our life, and it's how that trauma affects us that may later result in depression or anxiety or mental health disorders. There seems to still be a lot of misconception that if you're depressed, well, you're always going to be depressed. You're always going to struggle with that. To some extent, that's true. Just like if you have diabetes, it's a chronic disease. You're always going to struggle with diabetes. But that doesn't mean you can't get it into control and you can't get it into remission and you can't manage it. And so the same is true for depression and many other mental health disorders where, yes, you have it, but it does not define you. And it is something that you can manage. It's something you can go into remission from. Another misconception we sometimes have is it's one and done. So once you go through one TMS course or once you go through one course of SPRAVATO and go into remission, well, that's it, you're cured. Again, this is a lot like other disease processes and chronic disorders. For example, cancer. We talk about cancer in terms of remission, but unfortunately sometimes cancer can come back and then we have to treat it again to help put someone back into remission. Very similar is depression in terms of when we put you into remission, we sure do hope you stay in remission, but just know that life happens, life is difficult, and sometimes people fall out of remission. The good news though is if you know that TMS or SPRAVATO work to put you in remission, then you can try it again. And what we see in people is usually if it worked once, it will work again to help someone go into remission.